And today, we're all pleased to be able to announce over $8 million in new funding for the Rhode Island Department of Health from the federal government for public health preparedness and response efforts. Over $5 million of this funding is directed specifically at ensuring we have a robust public health workforce trained up and in position to respond to the next healthcare crisis, able to work in the communities, prepared to start from day one to deal with the next health crisis that faces us. One of the best ways we can be better prepared is to ensure that we have the public health workers already in place, and that's what this effort is designed to do. And in addition to strengthening our workforce, we need to improve community health, which is exactly what this funding will also do. This won't be a one-size-fits-all approach. Each community in our state has different healthcare realities. And the healthcare equity zones, under the leadership of Dr. Nicole Alexander Scott, are already working to identify those needs and put in place public health strategies that correspond to the public health challenges in these zones. In addition, this funding will provide nearly $2 million for school-based health efforts, so we can go ahead and ensure that our youngsters, our children, have the best possible health care. They get a good start both academically and in terms of their health. And we all know these are two related subjects. A child can't do well in school if it's suffering from a serious health problem. A child can't do well in school if they don't have access to health care. And so these are coupled together. It'll make our next generation and the following generations more productive, more able to deal with the challenges of this ever-changing world. And lastly, over $1 million in funding will go towards improving preparedness at our healthcare facilities. Our hospitals and our healthcare facilities did a marvelous job in COVID-19. They ensured patients got the best possible care. Our first responders, our nurses, our doctors sacrificed so much and did an extraordinary job. And now, as the disease is leveling off, we need to be thinking about how do we prepare facilities for the next event such as this. And this funding will go to do that. Now, we've got a lot more people to get vaccinated. We've got to get our economy started again, but it's never too early to prepare for the next crisis. And we always must be investing in our public health. I think one of the realities that was obvious when COVID struck is that we had been neglecting constant, important investments in public health for too long a time. We're not going to make that mistake again.